High blood pressure, also known as hypertension, is a common chronic condition affecting millions worldwide. People with hypertension are at increased risk for various health complications, especially when it comes to infections. Vaccines play a crucial role in protecting individuals with high blood pressure from preventable diseases. In this video, we'll explore which vaccines are commonly recommended for people with hypertension, why they matter, and how they help maintain overall health. Let's start by understanding why vaccination is particularly important for those living with high blood pressure. Vaccines are essential for everyone, but for people with high blood pressure, they offer an added layer of protection. Hypertension can weaken the immune system or make it harder for the body to fight off infections. This means that illnesses like the flu or pneumonia can be more severe and lead to complications. Vaccination helps reduce the risk of these infections, lowers the chance of hospitalization, and supports better long-term health outcomes. Next, let's look at the specific vaccines that are most often recommended for people with high blood pressure. The influenza vaccine, commonly known as the flu shot, is highly recommended for people with high blood pressure. Each year, the flu virus changes, so it's important to get vaccinated annually. For those with hypertension, catching the flu can lead to serious complications, including pneumonia, heart attacks, or worsening blood pressure control. The flu vaccine is safe, effective, and widely available. It's a simple step that can make a big difference in protecting your health during flu season. Pneumococcal vaccines protect against infections caused by the Streptococcus pneumoniae bacteria, which can lead to pneumonia, meningitis, and bloodstream infections. People with high blood pressure are at higher risk for these complications, especially as they age. There are two main types of pneumococcal vaccines, PCV13 and PPSV2/3. Your healthcare provider will recommend the best schedule based on your age and health status. Getting vaccinated can significantly reduce your risk of serious illness. The COVID-19 pandemic highlighted the importance of vaccination, especially for people with chronic conditions like high blood pressure. COVID-19 can cause more severe symptoms and complications in those with hypertension. Vaccines against COVID-19 have proven to be highly effective in preventing severe illness, hospitalization, and death. Booster doses are also recommended to maintain strong protection. If you have high blood pressure, staying up to date with COVID-19 vaccinations is crucial for your safety. Shingles, caused by the reactivation of the chickenpox virus, can be particularly painful and lead to complications, especially in older adults. People with high blood pressure are not at higher risk for shingles itself, but the complications can be more severe. The shingles vaccine, recommended for adults over 50, helps prevent this condition and its long-term effects. It's a valuable addition to the vaccine schedule for those managing hypertension. The Tdap vaccine protects against tetanus, diphtheria, and pertussis, whooping cough. While these diseases are not directly related to high blood pressure, adults should receive a Tdap booster every 10 years. For people with hypertension, staying up to date with all routine vaccinations, including Tdap, helps prevent avoidable illnesses that could complicate their health status. It's a simple way to maintain overall wellness. Hepatitis B is a serious liver infection that can have long-term health consequences. The hepatitis B vaccine is recommended for adults who are at risk, including those with certain medical conditions. While high blood pressure alone doesn't increase hepatitis B risk, people with hypertension often have other risk factors or may require medical procedures that increase their exposure. Vaccination offers important protection and peace of mind. In addition to the vaccines already mentioned, people with high blood pressure should ensure they are up to date with all routine adult vaccinations. This includes vaccines like measles, mumps, rubella, mumpers, and varicella, chickenpox, depending on age and medical history. Staying current with these vaccines helps prevent outbreaks and protects both individual and community health. Your healthcare provider can review your vaccination history and recommend any needed updates. Age plays a significant role in vaccine recommendations for people with high blood pressure. As we get older, our immune systems naturally weaken, making us more susceptible to infections. Certain vaccines, like the shingles and pneumococcal vaccines, are specifically recommended for older adults. It's important to discuss your age and health status with your doctor to ensure you receive the most appropriate vaccines for your needs. Living with high blood pressure often means managing other chronic conditions, such as diabetes or heart disease. These conditions can further weaken the immune system, increasing the risk of complications from infections. Vaccination becomes even more important in these cases. By staying up to date with recommended vaccines, you help protect yourself from preventable diseases and support your body's ability to stay healthy. Every person's health situation is unique. That's why it's essential to consult your healthcare provider about which vaccines are right for you. Your doctor will consider your age, medical history, and any other risk factors before making recommendations. They can also answer any questions you have about vaccine safety and effectiveness, ensuring you feel confident in your choices. One common concern is whether vaccines are safe for people with high blood pressure. The good news is that most vaccines are considered safe and effective for those with hypertension. Side effects are usually mild and temporary, such as soreness at the injection site or a low-grade fever. Serious side effects are rare. If you have concerns about specific vaccines, your healthcare provider can help address them and monitor your response. It's important to manage your blood pressure before and after receiving vaccines. Some people may feel anxious about shots, which can temporarily raise blood pressure. Try to stay calm, practice deep breathing, and let the healthcare staff know if you're feeling nervous. Monitoring your blood pressure regularly around the time of vaccination can help ensure you stay within a healthy range. The timing of vaccinations can be important, especially if you're managing multiple health conditions. Some vaccines are given seasonally, like the flu shot, while others follow a specific schedule. Your healthcare provider can help you plan the best timing for each vaccine, ensuring you get the maximum benefit without interfering with your blood pressure management or other treatments. Most vaccine side effects are mild and short-lived. Common reactions include redness, swelling, or soreness at the injection site, as well as mild fever or fatigue. These symptoms usually resolve within a few days. If you experience more severe symptoms, such as difficulty breathing or a high fever, seek medical attention right away. Remember, the benefits of vaccination far outweigh the risks for most people with high blood pressure. Allergic reactions to vaccines are very rare, but they can happen. If you have a history of severe allergies, especially to vaccine ingredients, let your healthcare provider know before getting vaccinated. They can help determine if a particular vaccine is safe for you and monitor you after the shot. Most people with high blood pressure can safely receive all recommended vaccines. Vaccines are highly effective at preventing serious illness, hospitalization, and complications from infectious diseases. For people with high blood pressure, this means a lower risk of severe outcomes if exposed to viruses or bacteria. While no vaccine is 100% effective, being vaccinated greatly reduces your chances of getting sick or experiencing complications. Staying up to date with recommended vaccines is one of the best ways to protect your health. When more people are vaccinated, it helps protect those who can't be vaccinated due to medical reasons. This concept, known as herd immunity or community immunity, is especially important for people with chronic conditions like high blood pressure. By getting vaccinated, you not only protect yourself, but also contribute to the health and safety of your community. If you plan to travel, especially internationally, you may need additional vaccines based on your destination. Some countries require proof of vaccination for diseases like yellow fever or hepatitis A. People with high blood pressure should consult their healthcare provider well before traveling to ensure they are protected and meet all entry requirements. Travel vaccines help prevent illness and ensure a safe trip. Most vaccines do not interact with blood pressure medications. However, it's always wise to inform your healthcare provider about all the medicines you're taking. This helps ensure there are no unexpected interactions and that you receive the safest care possible. Your provider can also advise you on the best timing for vaccines in relation to your medication schedule. A healthy lifestyle supports your immune system and helps vaccines work effectively. Eating a balanced diet, exercising regularly, managing stress, and getting enough sleep all contribute to better health outcomes. For people with high blood pressure, these habits also help control blood pressure and reduce the risk of complications. Vaccination is just one part of a comprehensive approach to staying healthy. Regular health checkups are important for everyone, especially those with high blood pressure. During these visits, your healthcare provider can review your vaccination status and recommend any needed updates. Annual checkups are a great opportunity to discuss your overall health, manage your blood pressure, and ensure you're protected against preventable diseases. It's important to keep a record of your vaccinations, especially if you have high blood pressure or other chronic conditions. This helps you and your healthcare provider track which vaccines you've received and when boosters are due. Keeping an up-to-date record ensures you never miss an important shot and can provide proof of vaccination when needed, such as for travel or work. Encouraging family members and close contacts to stay up to date with their vaccines helps create a safer environment for people with high blood pressure. This is especially important for those who may be more vulnerable to infections. By ensuring everyone around you is protected, you reduce the risk of bringing illnesses into your home and support each other's health. There are many myths and misconceptions about vaccines, especially regarding their safety and effectiveness for people with chronic conditions. It's important to rely on trusted sources, such as your healthcare provider or reputable health organizations, for accurate information. Vaccines are thoroughly tested and monitored for safety, and the benefits far outweigh the risks for most people, including those with high blood pressure. When seeking information about vaccines, It's best to consult your healthcare provider or refer to reputable organizations like the Centers for Disease Control and Prevention, CDC, or the World Health Organization, WHO. These sources provide up-to-date, evidence-based guidance on vaccine recommendations for people with high blood pressure and other health conditions. Vaccination significantly reduces the risk of hospitalization due to infectious diseases. For people with high blood pressure, this is especially important, as hospital stays can be more complicated and recovery may take longer. By staying up to date with recommended vaccines, you lower your chances of severe illness and the need for hospital care. Some infections, like the flu or pneumonia, can put extra strain on the heart and worsen blood pressure control. Vaccines help prevent these infections and support better heart health for people with hypertension. By reducing the risk of illness, you also lower the chance of heart attacks or other cardiovascular events related to infections. Some people with high blood pressure may belong to special populations, such as pregnant women, the elderly, or those with weakened immune systems. Vaccine recommendations may differ for these groups, so it's important to discuss your specific situation with your healthcare provider. They can tailor vaccine advice to your needs and ensure you receive the best protection possible. Booster shots are additional doses of a vaccine given after the initial series to maintain strong protection. For people with high blood pressure, staying up to date with booster shots is important, especially for vaccines like COVID, 19, and tetanus. Your healthcare provider will let you know when boosters are needed and help you keep your immunity strong. After receiving a vaccine, it's a good idea to monitor your blood pressure, especially if you're prone to fluctuations. Some people may notice temporary changes due to stress or mild side effects. Keeping track of your readings can help you and your healthcare provider spot any issues early and adjust your treatment plan if needed. Getting vaccinated can be stressful for some people, especially those with a fear of needles or medical procedures. Managing stress is important for keeping your blood pressure in check. Techniques like deep breathing, mindfulness, or bringing a friend for support can help make the experience more comfortable and reduce anxiety. A healthy diet supports your immune system and helps your body respond well to vaccines. Eating plenty of fruits, vegetables, whole grains, and lean proteins can make a difference. For people with high blood pressure, limiting salt and processed foods is also important. Good nutrition, combined with vaccination, helps you stay healthy and resilient. Regular physical activity helps control blood pressure and supports a strong immune system. Moderate exercise, such as walking, swimming, or cycling, can improve your body's response to vaccines. If you feel well after getting a shot, it's safe to continue your usual exercise routine. Always listen to your body and rest if you experience any side effects. Getting enough sleep is vital for a healthy immune system. Poor sleep can weaken your body's response to vaccines and make it harder to control blood pressure. Aim for 7 to 9 hours of quality sleep each night, especially around the time you receive a vaccine. Good sleep habits help you recover quickly and maximize the benefits of vaccination. It's best to avoid excessive alcohol consumption around the time of vaccination. Alcohol can weaken the immune system and may interfere with your body's response to vaccines. For people with high blood pressure, limiting alcohol is also important for blood pressure control. If you choose to drink, do so in moderation and follow your healthcare provider's advice. Smoking weakens the immune system and increases the risk of complications from infections. For people with high blood pressure, quitting smoking is one of the best things you can do for your health. Vaccines work better in non-smokers, and quitting helps control blood pressure and reduces the risk of heart disease. If you need help quitting, talk to your healthcare provider. Major life events or stress can affect your immune system and blood pressure. If you're going through a stressful period, let your healthcare provider know when planning vaccinations. They can help you find the best time to get your shots and offer support for managing stress, ensuring you get the most benefit from your vaccines. If you have allergies, especially to eggs or vaccine components, discuss this with your healthcare provider before getting vaccinated. Some vaccines, like certain flu shots, are made using eggs, but egg-free options are available. Your provider can help you choose the safest vaccine for your needs and monitor you for any reactions. People with immune disorders or those taking immunosuppressive medications may need special vaccine recommendations. If you have high blood pressure and an immune disorder, your healthcare provider will guide you on which vaccines are safe and when to receive them. Some live vaccines may not be suitable, but most inactivated vaccines are safe and effective. Pregnant women with high blood pressure should discuss vaccine recommendations with their healthcare provider. Some vaccines, like the flu and Tdap, are recommended during pregnancy to protect both mother and baby. Others, such as live vaccines, are generally avoided. Your provider will help you make the safest choices for you and your child. Some workplaces, especially in healthcare or public service, require certain vaccines for employees. If you have high blood pressure, make sure you meet all workplace vaccination requirements and keep your records up to date. This helps protect you, your coworkers, and the people you serve from preventable diseases. To recap, the most commonly recommended vaccines for people with high blood pressure include the flu shot, pneumococcal vaccines, COVID-19 vaccines, shingles vaccine, Tdap, and hepatitis B, along with all routine adult vaccines. Staying up to date with these shots helps protect you from serious infections and complications. Always consult your healthcare provider for personalized advice and keep your vaccination records current. Vaccines are a powerful tool in protecting people with high blood pressure from preventable diseases. By staying informed, working with your healthcare provider, and keeping up with recommended vaccines, you can support your health and well-being. Remember, prevention is always better than cure. Take charge of your health today and ensure you're protected for the future.